empirically.
Yeah, that led to the next question that I have for you, Joe, is so how do you follow how well the patient is doing with iNAP? What are the tool that you're using, the criteria that you're using that will eventually will tell you, hey, I need to maybe increase the pressure or to introduce the other tool that we have in our toolbox?
So typically we start off with a pretty good education on what the therapy is, introducing the apparatus to the patient. Then we'll have them watch an orientation video to get them comfortable with putting the device together. We'll have them wear an eye breath or even just the interface itself during the day to improve, to get comfortable with that tongue posture. And then once we do that, typically after about a week of usage, and immediately we have them download the iNAP Plus app, which will give us that remote daily monitoring. Be certain to have your patients to upload that daily because they have to do that actively. You can use the iNAP without using the software, and if you do that, you're blind. You don't see the patient's utilization. So they need to have their Bluetooth on and actively have that connected in the morning for us to see that seal. Initially, I encourage the patients too, as you're developing a better feel for appropriate tongue posture and more comfortable with nasal breathing, you'll notice that the seal will actually start to improve over time. So if they're getting less than, say, 60% time of seal throughout the night, which is what the software gives us, then that patient needs to keep working on their tongue posture. And then if after, say, a week or two, they're not maintaining that seal, that would trigger me to either have a telemedicine consultation or follow-up to talk about whether we need to start incrementally increasing the negative pressure. Typically, I do that in -10 to -15 intervals. Tends to be comfortable enough to be well tolerated. And as you monitor that on the software, you'll see that they'll get up to 80, 85, 90% or more seal time. Now we feel comfortable that this is actually applying an appropriate and adequate amount of oral negative pressure. And typically after about a month of that, if we need to do intermittent assessments, we'll use an oximeter similar to what you showed on the screen. The Circle Plus is a consumer available product, but it's actually been medically validated in all skin colors. So that's been an important thing in pulse oximetry. And it gives us an ODI as well as mean and average pulse oximetry and a relative actigraph-based hypnogram. Then we can also rely on the sleep image ring or even the night owl. I try to lean on more the low invasive products while we're titrating the patient actively. And once they get -50% from their baseline, that's typically where most of the research is encouraging us to say that that's a responder. And hopefully we can get them below 10 or even below 5 of the AHI. And then that would typically tell me that I need to do a more formal home sleep study on this patient. So that's my standard protocol. And if they're falling off of that, that's where our staff needs to be available, as well as the Somix team has been very, very important in that support team process to be available to bounce questions off of. And as Somix becomes more and more familiar with the community at large, I find they've been very responsive to my suggestions and other sleep clinician suggestions on, hey, I find that this might be more able to promote compliance or adherence to therapy, and they've responded very quickly. And I find that that's very likely I'm optimistic that that'll continue to be the case in the future.